Antimicrobial resistance, or AMR, is estimated to kill over 1 million people every year. This staggering figure has been climbing since the year 1990.
We disrupted the balance between environments and human beings by introducing antibiotics in massive scale.
How do we even begin to solve such a large problem?
The narrative around resistance needs to improve. If we tell better stories, I think we get better compliance, and we need to charge people more for when there is a breach, when there is a pollution issue.
In this episode, we'll explore how polluted water fuels the AMR crisis, why fixing it is so difficult, and how the people who can help might already be out there.
I'm Dana Clemenson.
And I'm Micah Schweitzer. This is Balancing the Future from METTLER Toledo.
On this show, we delve into the world of science and technology and explore its transformative impact on our lives.
Let's jump in.
In 1928, Alexander Fleming discovered penicillin in a moldy petri dish. Just 20 years later, mass production of the first effective antibiotic began. This breakthrough went on to save millions of lives.
Antibiotics have always and still do occur naturally. Evidence shows that over 2,000 years ago, ancient civilizations in places like Serbia, China, Greece, and Egypt used mold and certain types of soil to treat infections.
However, these days we produce and consume antibiotics on a colossal scale.
This rapid increase in manufacturing has driven many types of bacteria to evolve, making them harder to treat with antibiotics. MRSA, or methicillin-resistant Staphylococcus aureus, there's a reason most people call it MRSA, is one of the best-known AMRs. But there are, of course, many, many more varieties.
We have a very important issue in microbiology at the moment, which is the spread of antimicrobial resistant genes in bacteria through environmental water, so through wastewater.
That's the voice of Ana Almeida, an environmental and microbiology consultant. Ana has over 20 years' experience in academia, regulation, and industry.
And this is a problem that actually is being highlighted by the latest release of the legislation called the Urban Wastewater Treatment Directive. It's a very recent piece of document that actually tells the European member states that they will somehow have to monitor for these contaminants, specifically for genes that could give resistance to microorganisms against antibiotics. So I'm talking specifically about bacteria here.
Remember the Urban Wastewater Treatment Directive. We'll be returning to it later.
We have really a pronounced increase of resistance in infections in general, and people are unfortunately dying or getting really sick without possibility of treatments because the bacteria are just too resistant to what's available to treat infections. So understanding how that problem is spreading in the environment because of pollution, because of lack of appropriate treatment is very important. And it's something that the European Commission is quite concerned about.
Before we dig more into this, could you just explain to us, maybe in simple terms, what is antimicrobial resistance?
Sure. We have bacteria that are good for us, like, lactobacillus we have in our guts. They are fantastic. But we have microorganisms that are in the environment and they are not worried about us. They just are in the plants and in the water. And there are the microorganisms that are pathogenic. So these guys, they find our body particularly attractive to reproduce and multiply. So they infect us and cause disease. So we take an antibiotic, we have an infection, the microorganism just simply throw away the antibiotic. It does nothing to it. That particular organism, that infection you have, has already a resistant gene for that antibiotic. You're going to take the antibiotic, it's going to be doing nothing for you. You're going to continue to be sick.
And what microbes are we talking about? Which ones are most commonly resistant?
The WHO has a very interesting list called the I think it's the pathogen priority list, and they update that every year. So these are the microorganisms that are most frequently causing problems in hospitals. We have E. coli, Pseudomonas, aeruginosa. There are some fungi as well coming on the list now. They are in the priority list because the statistics of the infections are increasing and they're becoming more frequent and they're becoming more untreatable. So when people go to the hospital to have an operation or they go to have a C-section, they're more at risk because the antibiotics available cannot treat some of those infections. So it's a huge medical problem at the moment.
Are we meddling with things at an evolutionary level here?
Potentially. We disrupted the balance between environments and human beings by introducing antibiotics in massive scale. It's like the environment, there are fungi that produce antibiotics, they're naturally occurring antibiotics, but we decided to engineer in them in massive production, which is great. But this really changed the balance between the environment and the microorganisms and us. And now antimicrobial resistance rising is the price we're paying for it.
Does pollution in our water sources have any effect on antimicrobial resistance?
It does. Pharmaceuticals in general, especially antibiotics, if they are present in drinking water or in very small amounts, they will challenge or they will provoke this bacteria to become resistant. And that's why it's so important to increase our control of what's being discharged and how the wastewater, both from domestic and industrial usage, is being treated.
In late 2024, the European Union overhauled its 30-year-old Urban Wastewater Treatment Directive, laying down clearer rules and tougher accountability for member states. A major update: polluters now face extended producer responsibility.
This polluter pays principle came into effect on January 1st, 2025, forcing producers to cover at least 80% of the cost of cleaning up their pollutants. Financial accountability like this isn't new. In the 90s, the U.S. Oil Pollution Act gave authorities the power to make companies pay for oil spill cleanups.
But it will be interesting to see if shifting the financial burden to polluting manufacturers will drive down AMR in the coming years.
For now, testing plays a key role in monitoring the issue. Anna breaks it down into two main methods.
One, you can have agar plates. You can do the standard microbiology cultivation with media that contains antibiotic, and then you're going to see some profiles. But then you're going to study one organism against one antibiotic. Is this really telling you the full picture? It's telling you something. And then the challenge is, these regulators, which organism are we going to test for? Which media? Which antibiotic? So this is the first problem. The general way we test for fecal contamination through E. coli or some other microorganism does not work for antimicrobial resistance. It's different problem, different way to test. The way you need to test that is extract the genetic material from the water sample, so you get not one organism, not one antibiotic. You process that water in a very complicated way to extract the genetics of the bacteria in the water. And then you're going to use some genomic technique to map what genes are there and what organisms are there. To do that, you need to have a very good molecular biology laboratory. You need to have staff trained in doing DNA extraction, which is not simple. To get to a level where you actually get good techniques, it's a year or two at least. And you need access to laboratories that will do the libraries and understand what exactly is the genetic component on that sample. What is it telling you? And then you need somebody to interpret the data. So it's a completely different, let's say, complexity level that we have. It's possible. Research laboratories do that all the time. They have the staff, they have funding. When you go to the water utility level, and even if you pay a laboratory to do that test for you, then you see the cost multiplied per sample.
How far away are we from being able to detect AMR at scale?
I think the first problem that needs to be tackled is the way these chemicals are arriving in the environment, and we need to decrease pollution. And that's a big ask, but I think people are starting to realize the problem. I think this is a huge communication issue we have between science, knowledge, and who is causing the pollution, who is absorbing or suffering the effects of pollution. If we tell better stories, I think we get better compliance, and we need to charge people more for when there is a breach, when there is a pollution issue. Companies need to pay. I think this is also a financial mechanism that needs to be stricter.
What kind of challenges do these wastewater treatment plants have? Are they all testing in the same way? Are they testing differently? How does it work?
I think one of the, at least my experience working both as a researcher and a consultant for different environmental agencies, is that there is a lot of difference in the access of, I'm talking on the European level, of each member state, each country has different possibilities to implement a certain regulation. It's expensive to do microbial testing. It's not something that it has a huge cost, and you have to test samples on a certain frequency that also will have a cost. So the answer is the most wealth is the country. The test is going to be more intensive. Countries that have difficulty with their economies are going to have less testing. This is the general scenario. At the moment, we're not testing, as far as I'm aware, we're not testing for antimicrobial resistance at the water utility level yet in Europe. I think this will come into play in the next years because the directive is asking for that. And we have a cost, but the challenge is to implement a method that's actually affordable. Otherwise, how the water utilities are going to do that?
So if it's not being tested at the utility level, where is it being tested?
In laboratories, so in pilot scale, in the research laboratories of the Commission, they're trying to draw conclusions at the moment on the best effort, the best method to be testing that in large scale.
Just from my own understanding, like what water sources are they testing? Are you just going out to a river somewhere and scooping out some water, or is it closer to the actual wastewater treatment? What point of the water system is this testing happening?
This problem of antimicrobial resistance, it would be more wastewater utility target. It's more concentrated. You have the pharmaceuticals, you have the waste of the cities, people, the hospitals. So generally what they do is they're going to test before the wastewater treatment plants, in the inlet, in the outlet, and then depending of where your drinking water is being sourced, you're going to identify points that are more critical. It's also going to depend on location of your industry, effluents, where that's more critical, agriculture as well. So it really depends on how the geography of your pollution sources is distributed. So you need samples that are from the river, and you need samples that are actually from the wastewater treatment plant to do a good risk assessment of this problem.
We don't often think about where the water from our dishwasher or toilet goes, but usually wastewater eventually ends up in treatment plants.
In Europe, water from pharmaceutical sources must meet strict standards before it's released into the environment. But this is not the case everywhere.
We've talked a lot about the environmental impact of antibiotic waste, but what about the impact on human health?
I think it's the question that's plaguing researchers, how much that environmental risk is transferred to people. But from publications in the area, you see that the amount of bacteria that are resistant to antibiotics close to effluents from pharmaceutical effluents is going to be higher. The environmental pressure to select for that resistance is there. So how that goes back to people, it really depends on a number of factors, like the individual immunity. So is that person more sensitive, is immunocompromised, the exposure that person has to the water source. Maybe for me, it doesn't do anything for us here because we're healthy, but for a child or for an elderly, that person could get an infection. So there are models explaining the risk for different group categories and in different regions. And what I advise to people generally about environmental risk in general, every place in Europe has a water office or a government agency that's responsible for the environmental quality, your air, your water, they have to send and publish this information for us, and we can know exactly how certain risks are quantified and we are exposed to. So this information in general is something we have to have access.
I want to jump back into the challenges with monitoring the water contamination because we touched on it a little bit, but just to go over the challenges again, you had mentioned cost as a big problem for some countries. Regulation. Is there anything else that's a challenge when it comes to this?
I think it's the skilled people to work interpreting the data. That's a problem. And I think it's not only interpreting the data, but people that actually take the value of all these tests and analyze the results and bring to us, the users, the population, what is going on. We don't have enough communication from the science and the regulatory implementation of that science and those standards to people, to end users. Very few people know how to source the information, how to get value, how to know what is in it for me. We don't have enough scientists or qualified people that can actually tell better stories about what's going on in the environment. And I think this is a huge field of opportunity.
Because fundamentally what you're talking about is something that sounds like it could be quite abstract, testing water for certain microbe characteristics. But in the end, what you're talking about is human health, which is each of us individually.
Yeah, the field has such a complexity, and our narrative around these problems is very poor. That's what I'm trying to say. First of all, this is taxpayer money. So people are paying for the science behind that, funding that. They're not getting the value out of it. They're not getting the information they need. I think this is really something that, especially PhDs in biology, people that qualify so much, could really be exploring that communication better.
You've talked about the need for testing so that we know where to target the problem or exactly what the problem is that we're targeting. This, of course, requires people, as you said. So how can educational institutions and industries collaborate to create the skilled workforce that's needed for this work?
I have a feeling, and I know a lot of scientists in Europe between, let's say, 30 and 45 years old that have been qualified doing either PhDs or postdoctorates, and very skilled people. I think a lot of that qualification is already there. But the transferring of those skills into industry and into regulatory agencies or businesses that can use those skills is not happening as fast or as effectively as it could happen. So it's about qualifying people, but it's also about finding a way for the people that are already qualified to come to the marketing pact and bring change.
What could happen 5, 10, or 20 years down the line if we don't get AMR under control?
At the start of this episode, we mentioned a 2024 report from the Global Research on Antimicrobial Resistance, or GRAM project, which estimates that over 1 million lives have been lost to AMR every year since 1990. The report also forecasts that between 2025 and 2050, the total number of deaths could reach 39 million.
Published in The Lancet, the study emphasized that without major changes in legislation, we can't hope to reverse this crisis.
But there's another key part of the solution, a better narrative around appropriate antibiotic use. Here's Anna again.
So we have two problems there. One is infections that, like an influenza, as they call in Italy, a viral infection that lasts 7 days, don't need antibiotics. And people often want one, and they don't need, because not only it's not going to do anything for them, it's going to make them worse, because when you take an antibiotic, you don't need it. All your microbiota is kind of affected, if not killed. And then, there is a huge, you're basically beating up your immune system by taking an antibiotic. And the second problem is, when we have boxes of medicines that are not used, they need to go back to the pharmacy and properly manage. They're not supposed to go down the drain. They're not supposed to go into the bin. They need to go back to whoever can manage that waste properly. So this is on us, the users.
Where is the bigger source of this? Is it really, us taking antibiotics, or is it more the industrial use of antibiotics at scale on farms?
That's a good question. I think it depends on the production sites, and the statistics of that, Dana, is going to change depending on the country and how your industry group is compliant with the wastewater guidelines. So this is one question. I think in general, countries that have better economical status and social situation tend to have a better balance, so less pollution from the production site and from the end users. But in terms of how much each one is contributing for the problem, I don't know that answer.
But what I'm hearing, I guess, Dana was sort of saying, is it most of the responsibility over here and less of the responsibility over here? And what I'm hearing you say, the exact numbers notwithstanding, is that the responsibility is everywhere. The responsibility is shared. The source of this pollution is widespread.
That's right. I think animal use is a huge problem because it's massively used sometimes. I don't think in Europe that's allowed anymore, but in other regions of the globe, and then it comes the global aspect of this problem. Sometimes we're fine here in Europe and the US, we're controlling things, but then this other region of the globe where the antibiotic is being produced, imported into our market, they are not controlling the air effluents properly, they're not disposing properly the waste, and then the bacteria emerges there and travels here, and the problem spreads here. So there is that element of it's not only a local compliance issue, but a global aspect that we need to also consider, I think.
So if we take a positive view forward, if we can create better, more robust contamination detection methods, what's the outcome?
The outcome is when we have these answers more clear and we know exactly where are areas in Europe that are more problematic, we can go back to either the water utility and say, your wastewater treatment plant, we need to be upgraded with these treatments to remove these pollutants we found that are more frequent. So we're going to do that here. This is the funding. This is the financial mechanism we're going to give to your region. And the other thing is, I think also from a business point of view for companies that are working on these solutions, either as a treatment or detection, there is a huge market there to be explored, to be talked, to be shared, and to expand. So anyone that's working with environmental solutions today, and it's telling good stories, it has a good narrative, has something very good to be sold for water utilities, for who need to buy those solutions. So we need to improve our environmental quality. And I think this is how I would see kind of the long-term solution and how things could kind of communicate together to improve our environmental quality.
Anna, would you say antimicrobial resistance is a part of life at this point?
It is. I think we need to really accept that pollution is there. There is only so much we can do about it. And we have to kind of be in a good mental state, because keeping acceptance of there are certain things we cannot change right now. They're there. They need to improve, but we also need to live. And it is part of life. We do our best to combat this problem by being healthy, but by taking care of us, of our families, avoiding places that are polluted. And we take informed decisions on the best we can do, Micah, but we also need, from a human point of view, let it go a bit, because otherwise we kind of, oh my God, everything is done, and we can't do this.
What advice would you give to somebody early in a science career or in an environmental profession who could contribute to these solutions?
I think if there is one skill we need in scientists today, it's communication. And to communicate, you need to understand who that information is going to be useful for. Regulators, businesses, and people. Do a good market research to try and understand how your qualifications could address some of the problems we have today. We have so many problems. Every scientist I know could find a niche to work, to construct beautiful narratives online, and to find people to collaborate and bring solutions faster and more efficiently to people. So Tell good stories. Learn that gift. It's a beautiful use of your time and certainly gonna help you in your career.
We've been speaking to Ana Almeida, an environmental and microbiology consultant. Micah, what are your thoughts on this conversation we had with Ana?
Well, it struck me, of course, how grave the problem is and how important it is to find solutions to it, this issue of antibiotic microbial resistance. But obviously, it's a very multifaceted problem.
Yeah, with all of the challenges with effective regional regulations like those in Europe, without this overall global consistency.
Yeah, I mean, the bacteria, I suppose, don't care about national borders. They'll adapt to whatever the conditions are wherever they are. And so some kind of consistency, of course, would be to our benefit if we could somehow reach that at a regulatory level.
And I think just adding to the overall problem is how complex and difficult this testing process is. That's something that really surprised me. I thought it would be something that could easily be added into the steps that are taken in wastewater testing, but to hear that the science is so complex behind it, that was something I didn't realize.
Yeah, and I think that's an important point, that we don't put all the burden on the scientific community to do the testing, when in fact we need to look further upstream to prevent the problem from coming downstream, as it were. But on the other hand, I think that's a very hopeful note in the conversation that there are people who are trained, who are ready, and who are capable of being on the front lines with testing. So I think, it goes both ways to a certain degree.
This has been Balancing the Future from METTLER Toledo.
What questions about science and technology do you want answered in a future episode?
Let us know by leaving a review, or if you're a Spotify user, leave us a message in the comment section.
And be sure to subscribe wherever you get your podcasts.
We'll be back in 2 weeks with our next episode. See you then.